All right, we're going to do another GI-focused practice question for your Step 2 CK. I am Shell for I am COMAT. We'll go ahead and jump into it. All right, so go ahead and pause it. You can read the question, answer it yourself, and then we'll go ahead and jump into it. So we have a 45-year-old male who presents to his primary care physician with a complaint of intermittent epigastric and occasional upper mild abdominal pain. No significant medical history, denies alcohol consumption. His pain is relieved with food intake and antacids, and over the last few months he's experienced gradual decrease in appetite and has had weight loss. So he has epigastric tenderness, but there's no sign of overt gastrointestinal bleeding. And so the question's asking, what's the pathophysiological mechanism contributing to this patient's symptoms and weight loss? So there's a very key part in this question stem that you need to look out for, and it's this line right here. The pain is often relieved with food intake and antacids. So anytime you have pain that's worsened with eating, we're thinking of a problem in the stomach, whereas if it's relieved, we're thinking of a problem in the duodenum, or specifically like an ulcer in the duodenum. And the reason for that is the duodenum has the Brunner's gland, or something that secretes a lot of bicarb, and bicarb neutralizes acid. So if you have a bleed, stuff is, the acid's going to be burning or making that ulcer worse. But if you secrete bicarb, it helps neutralize that. It's going to help relieve some of that pain. And so we're thinking of a duodenal ulcer. So you got to keep that in mind as we approach the question. We see that he's having some weight loss. So we're having some problems with weight loss, and he has this ulcer. So we're trying to figure out what's going on here. So we'll go ahead and go through the answer choices here. So A, impaired gastric emptying. So that is the that is the wrong answer, because the patient's symptoms include epigastric discomfort, occasional mild abdominal pain, relief with food intake, weight loss, suggestive condition associated with meal-induced weight loss. We said that. So delayed gastric emptying typically presents in symptoms such as early satiety, bloating, vomiting, rather than intermittent epigastric discomfort and weight loss. And so if it was impaired gastric emptying, we'd probably see more bloating, vomiting. He would have the early satiety, but that's not quite what we're seeing here. He doesn't have that bloating sensation, so it's probably not impaired gastric emptying. And also, what we're thinking is something involving this ulcer, and that doesn't really point us to that. Looking at B, so GERD, heartburn, regurg. It's not really associated with weight loss, or quite the epigastric discomfort we're thinking of. So it makes this less likely. Where GERD, the esophageal contents is coming back up, or the stomach contents coming into the esophagus, and so that's not really what we're looking for here, because weight loss is more associated with a different condition. Altered pancreatic enzyme secretion. This is something that yes, could cause malabsorption. It's more seen in things like chronic pancreatitis or pancreatic tumors like Zolling-Ellison syndrome, which yes, Zolling-Ellison can cause duodenal ulcers, but you'd see a lot more, and he'd probably have other symptoms. And although in that sense, like you could make an argument for it, but the fact that he's not having any bleeding, bloody stools, you would have more symptoms like foul smelling diarrhea, steatorrhea, fat malabsorption, and we're not really seeing a lot of those big conditions. It's more of a mild condition here. And so if it, although pancreatic Zollinger-Ellison could cause a duodenal ulcer, it's not going to cause, because he's not presenting with the steatorrhea and the malabsorption, it's less likely to cause all those other symptoms, which because those symptoms weren't mentioned in his presentation. And then looking at E, chronic inflammatory bowel disease, that's going to present with the bloody stool, the diarrhea, abdominal cramping, and the widespread other systemic symptoms. So that's also unlikely. So even if you didn't know what the answer was here, just by eliminating the impaired gastric emptying because he doesn't have the bloating, the GERD because he doesn't have those GERD-like symptoms, and he doesn't have the steatorrhea or the bloody diarrhea, like you can eliminate a lot of these other answers. So even if you didn't know, that could kind of point you to D, which is the correct answer. And the reason D is the correct answer, the inadequate absorption of dietary fats, is because not being able to absorb dietary fats is kind of alluding to the duodenal ulcer without exactly stating it, because he's having some malabsorption issues, so that leads to the weight loss. Fat-soluble vitamins, fats, and it causes a disruption because you can't release the enzymes properly because the ulcer's there, but it's not quite as severe as if they had a tumor like Zollinger-Ellison, which you would see a lot more symptoms associated with that. and the fact that it's relieved with food intake, because an ulcer could cause this issue with dietary fat absorption, it could definitely point you towards the right answer. Like as I mentioned before, because of that buffering agent that you get from the Brunner's gland. And the pain relieved from food intake is something you would see with a peptic ulcer disease or a duodenal ulcer, as we see here. So there you have it. If you like that, go ahead and like and subscribe, and we'll see you in the next one. That's it.